For example, many conditions can cause other diseases, such as diabetes, obesity, tend to be risk factors for many other diseases, including heart failure and infections and things like that. Okay. Let's talk a little bit more about procedures. You guys are going to have some practices explaining all of these terms. And just remember for the tricky words to follow along with me so that you get more practice. If anyone has any questions at any point, please feel free to drop a question in the chat and I'll do my best to answer. Okay, so the first procedure is an EKG. It stands for electrocardiogram, but that word is probably a little bit more complex than you need. Many medical professionals use AKG instead to shorten the term. So what it does is it uses electrodes to measure your heart's electrical activity. One of the pros is that it's very non-invasive, it's not painful, and it's very easy and it's not expensive. But one of the cons is that if someone is having a heart attack early, it does not always show that they are having one. Because again, someone could be conscious when they're having a heart attack. It simply means that they are not having enough oxygen flow to their heart muscle. Okay, the next one is troponin testing. So troponin is a compound that is released when the heart muscle is being damaged. And what they do is they take your blood sample and test for that compound within your blood. So it is very accurate for heart attacks. But if a heart attack is happening very early and there is not high troponin levels in the blood, the heart attack could be missed. Okay. The next one is a chest X-ray. So a chest X-ray shows your doctors all of the structures inside the body, including like the lung and the heart size. They are pretty cheap and they're easy to do, but they do not show any blocked arteries, so it can be difficult to use this to diagnose something like a heart attack or anything perfusion or blood flow related. Okay. Echocardiogram. An echocardiogram is essentially an ultrasound of the heart. So you're looking at structures of the heart using sound. One of the pros is, again, it's easy, it's non-invasive, it's quick, it's cheap, and it actually shows blood movement. So you can see the pumping and the valves, which is a strong diagnostic tool if it's something like a heart attack. However, one of the things is that it is operator dependent, so it requires someone who has a lot of skill to be able to understand the structures of the heart and see what they're seeing on the echocardiogram. The next one is CT angiography. So it shows the heart and blood vessels, and this is a very useful way to also find clots or blockages. The way it works is that you use some radiation and contrast dye, which is injected into the patient so that we can see where the blood is flowing. So it is a little bit more invasive than all of our other procedures. And if patients are scared of things like needles or they're very anxious around their doctor, this might be something that you have to convince them to do. Another one is stress test, which is essentially having the patient exercise so that you can see if the heart is functioning as well as it should. So the procedure can detect reduced blood flow. So if the heart is not pumping as well as it should, then you could see that there's not enough blood going to the organs or going to the limbs. However, for people who are having very bad chest pain or are older or not stable, this is not ideal for them. Okay. Cardiac catheterization. So catheterization means to access like an artery and to actually put in an IV into the heart arteries. So this is the golden standard for blockages, but again, you're actually inserting a needle into the heart and the surrounding structures of the heart. So it is quite invasive, and there's also the bleeding risk when you go for this procedure. So all of these procedures have their own pros and cons. You probably heard of many of these procedures before. So when we're doing our practices today, try to think of, as you're doing your scenarios, try to think of which procedures would be ideal for each scenario and for each patient.
Perfect. Thank you so much, Vanessa. And I'll take on the following part. So next, we're going to talk about some treatments. So the first term we have is aspirin. Once again, aspirin. So this is going to help us prevent blood clots. So in your arteries or your veins, like in your blood vessels, there will be clots or clumps of blood, and this will prevent to help with the flow. So the pros of this is it helps save our heart muscle, and the cons will be bleeding risk because now your blood is very like thin. So it's gonna, yeah. And the next term we have is nitroglycerin. Nitroglycerin. So this one helps open up the heart blood vessels. So the pros is that it relieves angina, and the cons is that it may cause headache or low BP. BP stands for blood pressure. Next, we have beta blockers. Beta blockers. So this one helps slow down the heart, and it also helps reduce the oxygen demand. However, it will cause fatigue or dizziness. And then next we have statins. Statins. So this one helps lower the blood cholesterol level, and it helps us prevent future heart attacks. So like less of the clotting of the blood vessels. And then the cons is that it may cause muscle pain. And then next we have heparin. So heparin, it is a blood thinner, and it helps prevent clots, so similar to aspirin. And then the cons will be extra, like more bleeding. And then last we have stent. Stent. This one helps opens the blocked artery and to restore the blood flow. However, it can reblock the blood flow. And then next we're gonna talk about symptoms. So these are some important or like red flag symptoms. So first we have crushing chest pain. Crushing chest pain. So this is very dangerous because it might suggest a heart attack. Next, we have shortness of breath. Shortness of breath. And this one, it can signal heart or lung failure. So like something is wrong with your heart or your lungs. And then next, we have radiating pain. Radiating pain. So this one, it means, or like it is dangerous because the pain is spreading to your arm, your jaw, or back. This is classic for MI. And next we have diaphoresis. Diaphoresis. This one is dangerous because it means it is cold sweating, and it can be seen in heart attacks. And then next we have syncope. Syncope. And this one, it is dangerous because this is a faint, like fainting from having low blood flow to the brain. And then after that, we have hemoptysis. Hemoptysis. This one is when you cough out blood, and this one could signify some type of lung disease or pulmonary embolism. Sorry. And then the next one, we have sudden tearing pain. Sudden tearing pain. And this one could be a sign of aortic dissection. Any questions so far? Any repeat requests? Okay. So now that was it for our lecturing portion of today's lesson. And next, we're gonna head out into small breakout rooms where you will have one-on-one time to practice with our TAs. And so before everything, we wanna make sure that you have your week 3 handout out with you. So this is what it should look like. You should have been having this together with you, but this is, so if you look on the left side, there are 4 different tabs: vocab list, interview questions, case report template, and empathetic responses. So we will have some activities with your TA in the breakout room. So specifically activity 1 and activity 2. Activity 1, you will use this vocab list as a guide for you to help you answer questions. And then for activity 2, you will use this interview tab, case report template, and empathetic responses to help you with activity number 2. So in the meantime, please make sure to pull out the handout. Yes, and once the breakout rooms are ready, feel free to head out to the breakout rooms with your TA. Thank you, everyone. Yes, someone said, can I send the handout? Let me send the link in the group chat. Hi, everyone. Welcome back to the main room. I think everyone is here. Thank you so much for joining our lesson session today, and I hope you had a informative and helpful session with your TAs in the breakout rooms, and that you learned more about chest pain related problems and terminology. And so for this upcoming Sunday, so next week's lesson, we're going to talk about respiratory distress. So please, here's some things that we want you to do before the lesson next week. So can you please review the vocab list, the interview guide, the case report template, and the empathetic responses? So like everything should be in the same document, the same handout before our lesson next week. The Google Docs link to all of these are posted under week 4 on your class website. So that's where you can find it. Everything is posted. And we will have practice patient scenarios specific to this topic of respiratory distress next week. So it's good if you prepare yourself before the class to get the most out of it. And here, this is a picture of it. So if you go to Tuần, so week 4, you will see Google Doc link right here. That's where you find it. Second. And then for another thing that we would love if you could help us complete before Tuesday, 24th of March, before 11:59 p.m. is the feedback form for this session. This is session number 3. So can you complete the feedback before the due date? That'd be great, like before the deadline. Thank you. And then that's all. Thank you everyone for joining, and we would love to see you next week. If you have any questions, feel free to drop in the chat or like unmute yourself. But thank you for joining, everyone. It was a pleasure to see you. Hearts.
Yeah.
Thank you, everyone. Thank you for joining.